Advances in biomarking testing are transforming colorectal cancer treatment, offering patients precision-based therapies tailored to their unique cancer profile. And with the help of biomarker testing, oncologists have a safe, effective therapy option to offer patients and bring new hope. This morning, Dr. Christopher Liu and colorectal cancer patient Michelle joins us via Zoom with more. Good morning. Thank you both for being here.
Good morning. Thank you for having us.
So Dr. Liu, to start us off, can you explain what biomarkers are and why they've become such a critical tool in treating colorectal cancer today?
Yeah, thank you so much. We have seen incredible advances in the treatment of patients with metastatic colorectal cancer and colorectal cancer just in general. And we're really talking about personalizing therapy for our patients diagnosed with colorectal cancer. And that all starts with biomarker testing. And so biomarker testing has become a critical part of the standard of care for patients with metastatic colorectal cancer. So what is a biomarker? A biomarker is essentially anything that tells us what makes one person's cancer different than another person's cancer. And so this can be a gene or a protein. A lot of times doctors will tell their patients, oh, your tumor has a mutation in this particular gene. So why is this so important? This is important because we can step away from a one-size-fits-all treatment strategy and move more towards offering the right treatment for the right patient at the right time.
So then how does the biomarker testing change a patient's treatment plan compared, to those traditional methods?
So when you think about the history of treating cancer just in general, but definitely for colorectal cancer, it's always been a one-size-fits-all treatment for everybody, no matter how different your tumor might be from somebody else diagnosed with colorectal cancer. And that one-size-fits-all treatment has traditionally been chemotherapy. And so we know that chemotherapy can work for some patients, but we also know that it has a lot of side effects as well. So with a one-size-fits-all strategy, we shouldn't be surprised when chemo works sometimes for one patient but doesn't work for other patients as well. So a biomarker-driven strategy offers doctors the opportunity to offer patients better therapies. So what kind of therapies are we talking about? Targeted therapies that target something specific to the cancer that leaves healthy cells alone. What about immune therapies? The idea of teaching a body's immune system to fight cancer for the human body itself. And so whenever we give biomarker-directed therapy, we can expect a couple of things to happen. Number one, we expect a patient's tumor to respond better to these treatments because it's more personalized to their cancer. Number two, because we're offering targeted therapies to somebody's cancer, they may have less side effects to that treatment. And number three, you're going to hear an incredible story from Michelle, who's going to tell you that personalized therapy can help patients live longer. So if our patients are living longer with colorectal cancer and their quality of life is better and they're feeling better, well, that's the type of win that our patients should deserve and certainly should expect.
So Michelle, we're coming over to you now. You were diagnosed with stage 4 colorectal cancer. How did biomarker testing shape your personal treatment journey?
Thank you. So yes, in 2017, I was diagnosed with metastatic colorectal cancer. You can understand that that was pretty devastating, being pretty young at the time and very healthy. So I just could not understand how I was that sick. I didn't look sick, but inside my body, there was all kinds of things going on that I had no idea about. So the first oncologist that I saw told me that at best, I had a year left to live. And during that year was going to be a very extensive surgery, followed by lots of chemotherapy. Well, for the last year of my life, that did not sound like what I wanted to be doing. So I sought other treatment, sought another oncologist, and I got very lucky, and I got a doctor who knew about biomarker testing. So we sat down and we talked about what that would mean for me, my treatment, and longevity of my life. So together we tailored a plan of attack on the cancer. And as you can see, I am still alive right now. So that 2018 deadline, the first doctor wanted to give me, I have surpassed that. And just this week, I had my routine scans, and routine scans still came back as no evidence of metastatic disease at this time. We have plans still for the future, because right now, with all of the advancements that are being made, I know of new treatments just for my mutation in the last 2 years that have come up. And who has been helping me with that has been the Colorectal Cancer Alliance. They do know my mutation. The Colorectal Cancer Alliance is one of the leading nonprofits in colorectal cancer. They want to end this disease as quickly as possible. But when they hear something that is being approved for my mutation, they contact me immediately. So I know I also have them behind my back too. So I've got a team of doctors that are working and fighting with me specifically for my cancer and its abnormalities. And then I have the Alliance as well, which has proven to be extremely beneficial to me throughout my journey.
Well, Michelle, we are so happy here on Loving Living Local that you are still here to be able to share your experiences with our viewers and how you were able to overcome something like stage 4 colorectal cancer. Thank you both so much for your time here this morning.
Thank you so much, Krista.
Thank you.
If you'd like to learn more about the research being done on colorectal cancer and biomarkers, just visit the website you see on your screen.